So we've had some really interesting exploration of the ways in which climate change is already creating a lot of challenges. And I think the most appropriate next steps is to consider what we as healthcare researchers or health researchers and trusted community voices are able to do to be able to lead action on climate, to be able to protect the health of all. First Nations equity and recognition is very much a cornerstone of the work that we do at the Climate and Health Alliance. So I wanted to begin by doing an acknowledgement of country. So I would like to acknowledge the traditional owners of the land in which we're meeting today, which is the land of the Turrbal people. I was actually born and raised here in Turrbal country, so it's a place that's very close to my heart, and it brings me great pleasure to be able to pay my respects to the elders past, present, and emerging. If you haven't heard of CAHA before, we are Australia's peak body in climate and health. We're formed by about more than 100 different member organisations, which represent about 45 different health professions, including nursing, dentistry, medicine, public health, sonography, the list really goes on. And we have more than 200 different individual members who make up the Friends of CAHA. And we operate not just here in Australia, but also in New Zealand and across the Pacific. And we are always welcoming new members. This is our board of directors. So our board includes representatives of our member organisations, and each of them have diverse skills in public health and sustainable healthcare. That includes Australia's most recent Chief Medical Officer and our representative of the Public Health Association of Australia, Paul Kelly. And each of our board members apply external expertise to be able to run focus committees. So for instance, Aletha Ward heads our research committee, and Dr. Catherine Pendry heads our policy and advocacy committee. And this is our wonderful and diverse team that work across Australia. So Michelle and Dave are working from regional Victoria, Vanu from Perth, and internationally Rizal from Brisbane, Sade from Sydney, and many of us also work from Melbourne. I just wanted to quickly touch on our values. So we very much are trying to prioritise integrity and evidence, which is especially important to maintain community trust in an era where there is rampant misinformation and disinformation. So you may have heard this before, but the Lancet Countdown describes climate change as the single greatest threat to global health facing the world in the 21st century. And it is a deeply complex challenge because health is not only affected by climate change, but the health sector is very much a part of the problem, as we've heard from Meng earlier. With 4% of global emissions being attributable to healthcare, and here in Australia, that rises to 7%. But despite health being part of the problem, it provides a great opportunity for it also to be integral to the solution. So the difference that our organisation, the Climate and Health Alliance, can make is we seek to change the narrative by shifting the politics to in turn shift policy. And we do this to be able to accelerate action on climate change through our theory of change, which is if the healthcare sector leads on climate advocacy and solutions, decision makers and the public will act because the community cares about health and trusts health voices. Our opportunity is to step up and to deliver system-level change, which is grounded in the lived experience of people and communities. CAHA leads on bringing awareness to the health impacts of climate change. And we work with various levels of government to be able to provide evidence that informs policy. And I've pretty much touched on this a little bit, but this is just to emphasize that CAHA builds the power of the health movement for climate action, community resilience, and sustainable healthcare. Our strategic framework focuses on 3 interrelated pillars, which are seen on screen. This is health in all policies, which promotes equitable population health outcomes by influencing policy within and beyond the health sector. Our second strategic framework is health sector transformation, which accelerates the transition to a decarbonised, sustainable and resilient health system. And finally, Thriving Alliance, which seeks to build the strength and resilience of our alliance to be able to realise shared outcomes. We work with members to be able to develop and influence policy. Over several years, CAHA and our members developed a framework for the national approach to climate and health in Australia, and we were able to convince the Minister for Health to fund a national strategy. This was released in December 2023, and it's just the national strategy down on the left there. And we've had similar influence in New Zealand and across the Pacific and here in Australia on the state as well as the territory level. Given our region's vulnerability, we've been able to draw together evidence to be able to show why health needs to be central to adaptation and resilience planning. And then another key area of focus of CAHA is plastics and health. So we work from the health systems level to influence the International Plastics Treaty. And our work is very transdisciplinary. For instance, you can see in the photo on the right, that's our CEO, Michelle, with a supply chain expert, a surgeon, a procurement nurse, and a leading plastics researcher. Another example of the kind of work we undertake at CAHA is providing independent analysis of policies in the lead up to the election. We were able to raise awareness of health harms of fossil fuels and transport emissions, and be able to create awareness of clean air solutions. This involved joining collaborative campaigns like the Renew campaign to bring health messaging around clean energy solutions. To support health sector transformation, this entails delivering the GGHH program, which I will get into very soon, peer-to-peer learning, media and communications. What collective action means for us is entailing the healthcare workers being able to articulate links with patients and the broader community of climate and health, as well as health facilities being able to lead by example in decarbonising the delivery of healthcare, as well as preparing health systems to cope with consequences of climate change, and universities equipping the next generation of healthcare practitioners to address risks and impacts. So this is the example of healthcare sector transformation. CAHA coordinates the Global Green and Healthy Hospitals initiative in the Pacific. This is a project of the international NGO Healthcare Without Harm. And GGHH is a worldwide network of health institutions working to reduce the health sector's environmental footprint and fostering a healthy future for people and the planet. And GGHH currently includes 10 priority areas of action, which can be seen on the slide, which is leadership, waste, water, food, buildings, chemicals, energy, transportation, and pharmaceuticals and purchasing. And this slide is just to show how GGHH operates across the Pacific in Australia and New Zealand. Under Thriving Alliance, we strive to bring members together. And so the way we do this is we have our annual conference, which can be seen as the top left picture. So this year we've titled it the Climate and Health Summit, and it will actually be also in Queensland on the Gold Coast from the 26th to the 28th of October. We also like to bring members together through a CAHA members roundtable. To be able to have a sustainable impact, this requires our time to be valued. But also, if we're a high impact organisation, we can support a thriving alliance and ensure resourcing and action on climate and health across the region. So we have an abundance of resources on our website. If you'd like to learn more about our work, that's at kaha.org.au. And we're always welcoming new members, so if you'd like to find out more about how you can become involved as a member, you can scan the QR code that's on screen. Otherwise, my details are there. If you have any questions, please feel free to reach out. Thank you.
Thank you. Very interesting to see what CAHA is doing. Any questions?
Is this? Yes, thanks.
Yes.
Thank you for an interesting talk. So I'm from the Netherlands, a country which basically half of it is already below sea level. So the threat is pretty real for us. But in recent polling, in recent polls, it was shown that the younger generation actually cares less about climate change than the older generation. So there's kind of like after an increase, it's now going down. So I wonder if you have observed something similar in Australia, and if yes, what do you think is a way to deal with this? Because it sometimes feels like you're battling against something that you know only gets worse over time. Or, yeah.
Yeah, that's a really interesting question, and we've very much had the opposite here in Australia. A lot of the kind of momentum that's been garnered around climate action has been driven by the younger generation, which is why recently we've secured funding to do a youth climate and health summit here in Melbourne. And that's been funded by the City of Melbourne, and we are putting together a Youth Climate and Health Council for young people to be able to have a bit more of an input, because I'm sure there's probably plenty of mental health, concerns around young people feeling like they don't have a say. So one of our missions at CAHA was to be able to involve the voices of young people and put together projects. So that's why our Youth Climate and Health Summit is, it's 2 days, and the first day is around climate and health education, but the second day involves working in groups to propose sustainable health solutions, and then that will be judged by an expert panel, and the winning solution will have their project funded and supported to be able to be scaled up. So we're actively trying to involve the voices of young people, as we've found that they've really been wanting to engage with the work that we do.
Hi, thank you for your talk. Have you encountered any pushback from different stakeholders when you try to influence policies in the health sector or government things? And if so, then how do you deal with this?
Absolutely. I think the work that we do, especially as a not-for-profit organisation where we rely on funding, is being very careful about how not treading on certain people's toes. So, for example, we have our support for our annual conference here in Queensland, which we are receiving support, but certain stakeholders perhaps don't want to be named. So we're very careful to be very transparent and have a lot of prioritise integrity with our work. But for instance, our campaign can never be highly politicised, because as a not-profit that has DGR status, which is gift donation refundable status, we're not actually allowed to be supporting any particular party, say, but as a organization that's focused on educating in climate and health, we can provide a summary of, for example, what policies in climate and health certain parties are supporting or not supporting through their policies. So that's kind of a few ways in which we've been mediating that. Yeah.
Okay, thank you.
Hi, thanks for the talk. A lot of those climate change and all the things are very global problems. So, like, you know, any local organization is useful, but I think I'm wondering if you have. I mean, you already said that you're working with the global health network, and I'm wondering if globally, if you have some ways of knowing exactly what is the most impactful sort of action? What are the biggest problems to solve, and what's the most impactful thing that you and partnering with a more global organization to, like, kind of relay that one message that can kind of take, you know, and have a sort of a bigger impact. So one of the questions is really how do we know where we should be acting on first? You know, I know there's plenty of things, but in one of your slides there was like 12 possible, you know, direction.
Yeah.
But we know what are the maybe 1, 2, or 3 critical things, and how do we spread that globally through? I mean, maybe some of the organization. Maybe those are my 2 questions.
Yeah. So in each of the kind of priority areas where we're focusing on in climate and health, we seek to use research and evidence basis to inform whatever kind of policy decisions that we're kind of pushing for. So at the moment, as the Research and Partnerships Advisor, some of my work is to be able to reach out and collaborate with research institutions to see where our strengths are most needed. So that's one way in which we ensure that our efforts are impactful and relevant. Another way is through our Thriving Alliance being able to collaborate with organizations on a global scale, like Healthcare Without Harm. So a huge kind of focus for us is the emissions of the healthcare sector itself. So working with that organization to spread awareness of the impacts of the emissions of the healthcare sector, and working with hospitals across the region to be able to reduce emissions and look at things like food waste, single-use plastic, those kinds of things.
Thanks. I mean, maybe that's a longer discussion, but yeah.
Oh yeah, sure. Sorry.
Yeah, thank you so much.
Thank you.
Wonderful talk. So we are running a bit behind schedule, and so we skip on the panel discussion. But before I let you go into the post-session, I do have an important question for you. So what do you think we should do as the CSIC to kind of like promote sustainability within OHBM? I mean, it's super awkward, but maybe think about it. You can also really just either grab any of us, we are here for the day, or email us, add us on Blue Sky.
So I mostly work as a climate change psychologist, and I go to all of these conferences that are related to climate action, and there basically it's completely common for the conferences to be organized very sustainably. Like, for example, the food we're being offered is almost exclusively vegan, and basically never anything else than a vegetarian. And I think there are a lot of steps that can be taken to pressure the organizers to pay more attention to that, so that the emissions are reduced as much as possible, which I feel is something that we could be in a position to do. So, and also for choosing locations, so I have no idea. I mean, I understand that it's a very complicated process, but also making some calculations about locations where emissions would be averagely lower. If we select that location, that could also be something meaningful that we could be doing, because I saw you're already making these calculations anyway. So yeah, that could be something.
Yeah, thank you. Thank you. We are actually, at the moment, we are in the progress of making, how can I say it, maybe guidelines or like a guide on how to integrate the sustainability of the location into like the decision making. So this is happening at the moment. So you're very welcome to contribute if you like. Is there any more thoughts? That's okay, it's Saturday. It has been a long week for all of us. So, but yeah, we would be very happy if you just kind of like think about it and reach out, have chats. Yeah, go for it.
Yeah. Maybe just a question I have, because during COVID, for me personally at least, I learned that online conferences don't really work for me as well as just coming together physically. But I understand it's of course the footprint is like goes almost to zero if you would organize it fully online. So was wondering like what the idea of OSIG is, of the CSIG, sorry, in this confusing, or in this question, like how do we find a balance between the usefulness of conferences and being sustainable?
I mean, I find like it needs to be a balance. So I think there's no either or. There should be a somewhat in-between solution. So for example, we could discuss things like having a centralized main organization and having local hubs in different continents. This, for example, could work. I don't know how it is, for example, happening for the other OHBM chapters, but for the Australian one, we do have a local annual Australian OHBM meeting. So I feel like this could be a compromise between we are meeting all together in one place versus we are meeting kind of like locally together, but we are still connected, like networks in the brain, where you do have a hub and like, I don't know. It's
a nice analogy, thanks. Yeah, you want to add?
Yeah, I have a thought. I'm also part of CSIG, and it's been a point of discussion for the last 5 years for us. We do acknowledge it's a trade-off, as Anna said, between inclusivity of the different locations around the world and the different research groups who want to be represented locally, and sustainability. So we completely acknowledge that. Again, like Anna said, it's a point of balance, but there are multiple things we could do in terms of how we pick the location. I think, as you mentioned as well, sustainability should be part of the equation when you're organizing the conference. So we're moving more towards having a seat at the table, at the council, so we can have more say into where we go, how we go. In a nerdy way, it's an optimization problem. So if we can kind of try to solve it in that way. But to be completely frank, I mean, yes, we are here. I came from Montreal. I contributed to the carbon footprint when I came here. So we're completely aware of that. So we need more ideas, more people, more voices at the CSIG to tackle these large challenges. So if you're interested, just join us. We are very happy to get more ideas. We are still a very new SIG. So again, everything is up for discussion, and we're very happy to get new contributors to all the things we do.
In terms of traveling, there's previous conferences where I've been where they encourage people to adopt sustainable traveling and where they kind of encourage people to calculate. And then this was a conference that was held in Europe, but they were inviting people that were traveling within Europe to use trains or different means of transportation that might be a bit more, take more time, but that have a better impact. And people were encouraged, and on the site of the conference, even if the conference was held for specific days, they were encouraging people to choose to have places where they could work the days before or after, so that they would have access in co-working spaces to be able to travel on days where they could maybe travel as a group. So it was less, again, people were using the same modes of transportation. So that might be a way also to encourage people to be more aware if OHBM were to encourage people to travel more sustainably. Coming to Australia is a bit difficult for that,
yeah,
but other places might be a bit easier. And I live here now, so it's easier, but yeah, it's understandably a lot of people had to travel far.
So what I do get from your message is basically OHBM could be more kind of like upfront on how to make things or how to incorporate things into your personal decisions.
And like that other conference, I'm a speech pathologist. It was a Academy of Aphasia. There was like special mentions of the people who actually managed to travel with the lowest footprint. So people were encouraged to
like a competition.
kind of.
You get a
And
gold
so-
star
exactly,
for walking.
Exactly, but just to have it be more, have people think intentionally of how my personal decisions can have an impact or what it means.
Yeah, that's a nice idea.
So if there are no other ideas, I just have one other, not really related to that question, but whether there is general interest in a also subgroup that is interested in environmental neuroscience, so more on the how does environmental factors also related to climate change impact brain health and cognition, and how we can use also neuroimaging to address that, because now I feel like more and more people are moving into this field, and we also have an international group on climate change and brain health specifically. So I feel there is like a lot of potential to nicely connect with that group, and I feel, I'm wondering if there are others interested, because I would be very interested also in like joining and like,
Yeah, we do have other people interested in the intersection of brain health and climate change, and we have discussed integrating this also in the kind of like 5-year plan of the CSIC. I personally have moved some of my research interest in exactly this direction and using kind of like brain images to see what climate is doing to us in the end.
Awesome.
So yeah, there's this interest. Nice. Okay. Thank you so much for coming. Thank you so much for your amazing talks. Enjoy the rest of the day, the rest of OHBM, and see you next year.